Hi, I have nil financial disclosures. So I want you to imagine a 35 years old IT professional presents to your OPD with severe vision loss due to atypical optic neuritis. You obviously investigate and treat her disease, but my question to you is, how often do you ask her, how are you feeling? How are you coping up with this condition? Frankly, you don't. And unfortunately, neuro-ophthalmological conditions do cause debilitating mental state, either due to the acute presentation, the chronic course, or at times due to grave prognosis. So with this study, we report our experience with screening for depression, anxiety, and distress in patients with various neuro-ophthalmological disorders using a novel tool, emotional thermometers. In this prospective study, we recruited neuro-ophthalmology patients more than 18 years of age who presented to us from July 23 to September 23. We excluded the younger patients, those who were already diagnosed with some psychiatric issues or were on some medications, the vulnerable patients, and non-English speaking patients. After confirmation of the etiological diagnosis, those who consented were enrolled in the study. Now you see, these are the emotional thermometers. Emotional thermometers are a short visual analog scale to screen the patients for psychosocial risk. Our patients tick this scale depending on their perceived levels of distress, anxiety, depression, anger, and need for psychological help. The cutoff value is more than 3 for first 4 domains, and any non-zero value for the 5th domain were considered significant, and the statistical analysis was done using linear regression and multinomial logistic regression. We recruited 60 patients with mean age of 45, ranging from 19 to 78 years. 55% were males. The most common presenting complaint was double vision or acquired squint in 47%. The most common onset was acute in 62% of the cases. The most common ocular manifestation was craniomotor nerve palsy in 35% patients. Other patients had papillitis, optic atrophy, neurological field defects, ocular myasthenia. On emotional thermometer scoring, if you can see, about 50% of the patients scored significant distress and anxiety. And it is noteworthy to see here that about 45% of the patients self-reported that they need some kind of psychological help to cope up with their current condition. And the overall incidence of emotional distress in our cohort was 53.33%. On linear regression analysis, the age of the patient and the duration of the symptoms did not show statistical significance with the estimated scores, whereas the need for neuroimaging, the patients who needed neuroimaging had the highest risk for having emotional distress, followed by those patients with acute onset of the disease and females. Now, emotional thermometers have established its validity and reliability across different subspecialties of modern medicine, and it has been extensively used in cancer patients to screen them for depression. Among ophthalmology disease patients, this meta-analysis shows the pooled prevalence of 31% for anxiety symptoms, but majority of these studies cater to the population of dry eye disease, uveitis, glaucoma. But there is scarcity of literature when it comes to neuro-ophthalmology, and our study is one of its kind. On comparison of emotional thermometers with that of other conventional scales what are used to screen for depression in hospital settings, emotional thermometers being visual analog are short, non-wordy, and very easy to understand as well as to administer. Our study has few limitations. We excluded the non-English speaking patients, and so we are trying to translate these scale into the local languages so that you can include those patients as well. We could not subanalyze the patients with diminution of vision, monocular versus binocular, or depending on the severity of diminution of vision, and it needs a larger sample size. So our study signifies the usefulness of this novel screening tool, first time in the setting of ophthalmology. Neuro-ophthalmological disorders do cause significant emotional distress. As a physician and the treating ophthalmologist, we can help detect depression or anxiety and prompt such patients for timely help for their overall well-being. Thank you.
Thank you so much.